Good evening. This is Mairead Painter, the State Long-Term Care Ombudsman in Connecticut. Coming to you tonight is December. Good evening. This is Mairead Painter. Let me turn the volume down over here, right? Now you're listening to me, listen to myself. It's December 16th. We're coming to you tonight for our regular discussion about long-term care, what's happening in our long-term care system. And tonight we're going to focus on the vaccine specifically. I want to welcome, we have 3 experts with us this evening, and so they're going to be here to answer questions, and we're going to have a discussion related to the vaccine. I want to introduce Dr. Vivian Luang from the Department of Public Health, Dr. David Bannock from UConn, who is also the co-chair on the subcommittee for the vaccine related to the science of it, and Dr. Patrick Cole, also from UConn. So thank you very much for joining us this evening to take questions and to help people have a better understanding of what's coming and what we can look forward to. I don't know if you each want to give a quick little introduction for yourself. We can start with Dr. Lang.
Hi, everyone. Many of you may already know me as I oversee the Healthcare Associated Infections Program at the Connecticut Department of Public Health. We are the epidemiology department, the infectious diseases and infection control subject matter experts in the department, and we've been working with the long-term care facilities in detecting and controlling outbreaks and cases of COVID-19.
Okay, Dr. Bannock.
Hi, I'm David Bannock. I'm an infectious disease doctor at UConn Health. In my role, I take care of patients with infections in the hospital and in the office, including COVID-19 in the hospital. And my other roles, I am the medical director for our infection control program at UConn Health. And then lastly, with regard to the COVID-19 vaccine, as was mentioned, I'm the co-chair of the scientific subgroup for the Governor's Vaccine Advisory Committee.
Wonderful. Thank you. And Dr. Cole.
Yeah, good evening, everyone. So I'm a geriatrician. I work at UConn Health, like David does. I was a medical director of long-term care for 28 years, and back in the spring, had a lot of personal experience diagnosing and taking care of patients in nursing homes who had COVID and COVID-related complications. So I'm happy to be here this evening.
Thank you very much. So we'll start right off with questions so we get the most out of our time here this evening. We had several people who emailed questions in, some residents. The first question is, if I have had COVID, do I need to or should I receive the vaccine?
So I can take that one. Sure. So what we know about COVID is that when an individual gets infected with COVID, there is an immune response, and that likely provides some protection. And we've also seen that there have been some cases of reinfections. So I think for that purpose, the CDC guidance is recommending that even individuals who have had COVID in the past can be vaccinated against COVID. In fact, in the phase 3 clinical trials, they included individuals who had COVID prior to enrolling in the trial, and found that even when they were vaccinated, there were no safety-related concerns, and that they accepted the vaccine and tolerated the vaccine okay. So at this point, that's the recommendation moving forward, that individuals with a history of COVID, can be vaccinated against COVID-19, with the help of providing ongoing immunity moving forward.
So I would say, yes. You should definitely get vaccinated, no matter what your COVID history is. David, would you say that the only people that maybe should defer vaccination for later is if you're acutely ill, if you have acute signs and symptoms related to COVID-19, then you may want to wait till you recover from a acute illness?
Yeah, that's a very important point. So during the time in which someone has COVID-19 infection, there's a period of isolation, and during that period of isolation, you wouldn't want to give a vaccine, so the person should remain isolated. But then once that concludes, that person would be eligible for a COVID-19 vaccine. So thanks for bringing up that point.
Wonderful. And that was actually our next question. Someone asked if there's currently COVID in my nursing home and an outbreak and I have COVID, should I get it? So they should pause and wait and then receive it once they recover.
Yes. However, if you're not sick, but there is COVID in the building, you should still get it. Only if you are acutely sick and infectious should you defer.
Perfect.
And I would just add, this population, nursing home population, I think everybody knows at this point, were particularly affected by COVID, are being particularly affected by COVID, are at very high risk for serious complications and death from COVID. So that's one of the reasons why the nursing home population has been prioritized to receive the vaccine so soon and so early in the process. And I think it's just so important that nursing home residents and nursing home staff, which I'm sure we'll answer some questions about, be vaccinated and be vaccinated as soon as possible.
Excellent. Thank you. If I'm a short-term resident and I receive my first shot at the nursing home and then I'm discharged because I'm done with my stay, how do I get my second shot? Is there a plan for that?
Yeah, so that has come up with CDC and Walgreens and CVS. So CDC is coordinating the long-term care pharmacy partnership program, which is involved in that program is 3 visits to every long-term care facility in the nation who agrees. And everyone in Connecticut, all long-term care facilities in Connecticut are part of that partnership with CVS and Walgreens. So those 3 visits happen. And if somebody is discharged, there's details being worked out right now with the pharmacies and CDC, but some of the options include going back to the facility on a subsequent scheduled vaccine clinic day, working with the facility to figure out what a safe plan would be for vaccination, whether that is within the entryway or in some area within the facility that somebody who was discharged can come in and get vaccinated, or perhaps going to a retail pharmacy location for that subsequent vaccination. These details are being rolled out very rapidly, and details are still being figured out, but that will be in place when that second dose needs to happen.
Thank you very much. Any other comments or? All right, so the next question, will staff and residents get vaccinated on the same day? And if so, what if there are side effects or the staff have a fever? Will they be able to come to work and care for me?
So I can answer that question. I think for staff, it probably makes sense to stagger the vaccination of staff. As was mentioned, the side effects from these vaccines is minimal there, but people can feel a little ill, and so it's recommended that staff be vaccinated in a staggered manner, not everyone at the same time. I think for the residents, there's no reason not to vaccinate everyone at the same time.
Yeah.
Yes.
So yeah, staff and residents can be vaccinated on the same day. The staggering, with 3 visits in the pharmacy program might make it a little difficult. It's important to note that people can become symptomatic and continue to work if those symptoms are not suggestive of COVID-19. If it's respiratory illness that develops, that is not likely from the vaccine, so that needs to be checked out. Fever, muscle aches can happen. If you have a fever, typically you don't want to be working. David, I don't know, do we know much about the frequency of fever? I know that the frequency of side effects will be more with the second dose than with the first dose.
Yeah, so what we can say about side effects is, we do see side effects after both doses. The most common side effect is localized discomfort, maybe some swelling or redness at the injection site, and that seems to be relatively common. The other side effects, things like the fatigue and the fevers are less common, and they seem to be, as Dr. Long mentioned, much more common after the second dose. They also tend to be more common in younger individuals than older individuals. And if you want to get a sense of the frequency of things like fever, based on the data, at least from the Pfizer study and the early studies from Moderna, the rate of fever after the first dose seems to be around like 3 to 5% of people who get it, and then in the second dose it's around 10%. So even though we have a lot of concern for any of these side effects, in the bigger picture they don't occur with a very high frequency, other than the localized skin discomfort, which is expected with any vaccine. So I think we have to be mindful of them, and staggering is something that we've been doing in the hospital when it comes to giving our vaccines to certain units, because we don't want, in case everyone had side effects at the same time, like fever, we would want to avoid that. But I think in the bigger picture, these seem to be not incredibly frequent, and that's a good thing. I will note, and I didn't mention this at the beginning, that I have received a COVID vaccine. I got my COVID vaccine yesterday, and I feel great. So that's my sample size of one. But I think the clinical trials, which had sample sizes in the tens of thousands, showed that the rate of side effects was relatively low.
Excellent. I'm glad to hear that you had your vaccine. Wonderful. Dr. Cole, did you want to add anything?
Just that I'm scheduled to get my vaccine next week, and I'm looking forward to it.
I am as well. All right. For individuals who either do or do not get the vaccine, do they have to be separately cohorted, like residents who now have COVID or do not have COVID? Will they live in separate parts of the nursing home?
That is not a recommendation at this time to cohort based on vaccination status, and I don't think that will be. Cohorting will continue to be based on who is infectious and who is naive or vulnerable to infection, not due to vaccination.
All right. If I get vaccinated, will I be able to have access to my family member and visitors? I can actually take a little bit of a poke at that one. We have been actively engaging with CMS on this, and at this time, there are no changes to the visitation guidance. I think that we're still we have a little road to go to see how things are going to play out and what's exactly going to happen. I think everyone across the board knows that this is an extremely important topic, and that everyone wants you to have the connection to your family members and your loved ones. We want to do that as soon as possible in a safe and appropriate way. And hopefully we'll get back to a point as cases decrease that we'll be able to have those indoor visits start regularly again and have that access. But to my knowledge, there's no change to the federal guidance at this time.
So I would just concur, and just to add to that, Mairead. So this has been one of the, apart from being at risk for getting COVID, one of the big drawbacks to COVID for long-term care residents has been, not being able to see their family, and for their family not being able to see their loved ones. And so getting vaccinated will be an important step to eventually changing and lifting those restrictions. Because when it's clear that people have been vaccinated and the infection rates have dropped, as we anticipate they will, then those restrictions will obviously at some point in the future be deemed unnecessary. So the sooner people get vaccinated, the more people that get vaccinated, the sooner those restrictions will change.
Thank you very much. I know that's a really important topic for a lot of people listening this evening. The last question that was sent in is, if I say no to the vaccine now, and I change my mind next week or the week after, what is the process for me to then receive the vaccine? So Dr. Lang, you said that there's a 3-step process. So maybe if they catch it soon enough, then they'd be able to have someone come see them.
Exactly. Yeah. If you decide that you said no initially, but you decide yes before the subsequent visits from CVS and Walgreens, you can be vaccinated during those subsequent visits. If you want a vaccine after those 3 visits are over, by that time, there will be other means of getting vaccinated. We're still trying to figure out if eventually long-term care facilities can administer within their facilities. It will likely be that pharmacies will be vaccinating and a lot of primary care outpatient sites will be vaccinating. We're still trying to figure out whether or not long-term care facilities themselves can vaccinate within the facility, given the requirements of the different vaccines that are coming out, the temperature requirements, for example.
Thank you. And now we're able to go to the live questions, and it's nice. I'm seeing so many of our regular people on. So hello, everyone. We're getting a lot of hellos on here and a lot of thank you all for joining us this evening and making this a priority. So thank you from the group. We have a couple people from out of state checking in. All right, from Jacqueline, just wondering if one entered a nursing home and conducts a compassionate care visit with a family member, are we to then quarantine for 14 days or 10 days? So I'm guessing that's someone who has COVID and it's a compassionate care visit and you're going in to do that visit. How long should they quarantine after that visit?
So I can start and others can fill in. So the safest quarantine time, if you have had close contact with somebody who has COVID-19 infection and still is infectious with COVID-19, is a 14-day quarantine period. That is the amount of time that you can possibly be brewing or incubating COVID-19 before you become sick and infectious. You might have seen that CDC has suggested shortened quarantine periods, 10 days after exposure or 7 days after exposure. These, if you look at the CDC website, come with some very strict caveats, meaning you absolutely need to be monitoring your symptoms and you have to be symptom-free at that time. And then it also specifies in CDC guidance that there is a risk of residual transmission if you shorten your quarantine period. Those are up there as options for people who might need to shorten quarantine and want to know a little bit about the risk of shortening in quarantine.
Thank you. That's very helpful. So
does anybody else have anything to add? All right.
That's okay.
Thank you. How do we know if the vaccine will be compatible with other medications that a resident might be on? No.
I can comment on that a little bit. So, at this point, this vaccine, it works using a very independent mechanism. Just like the flu vaccine, it works by basically giving an individual something that stimulates their immune system to make the white blood cells and the antibodies that they need to protect themselves. And the medications wouldn't necessarily impact that whole process. So I think there wouldn't be necessarily any medication interactions that we need to be worrying about. And fortunately, because it's not a live vaccine, things like immunosuppression become less of an issue in terms of safety. The vaccine can still be given to folks that are even on immunosuppressant medication. So I don't think that there's any major medication vaccine interactions that have been put forth by the FDA when the vaccine was authorized that have been noted, or anything that was specified in the clinical trials as exclusion.
Yeah, I would just concur with what David said. We have had some vaccines in the past that have been contraindicated for patients who are on immunosuppressive medications, but that's not the case for these COVID vaccines.
So would you recommend that if someone had a question or a concern that they talk to their primary care practitioner at the long-term care setting and just run the questions by them?
Yes, I think that they're attending in the facility, even the director of nurses, the infection control nurse. There'll be a variety of folks at the facility who will be, able and qualified to answer those questions.
Wonderful, thank you. Next question is, for someone 85 years old is still recovering from COVID, is the vaccine advisable? How long after the recovery should we wait to get the vaccine? I think you touched on that, Dr. Lung, and said once they're recovered, Is that when they're no longer symptomatic?
So I would say the timing would be more related to when they're no longer considered infectious to others. So after that period ends, that individual would be eligible to be vaccinated. And the age per se wouldn't necessarily factor into that.
All right, so Deb has a question. I want to cut to the chase. We all have been looking forward to the vaccine in nursing homes to allow an essential caregiver minimally back in. From what I've heard from administrators and medical directors, this is not the case. If a resident is vaccinated and the staff is, and now protected, why aren't loved ones going to be allowed back in to alleviate the effects of isolation that has been devastating to them? So what would that risk be related to coming back in if residents and staff have been vaccinated? We know it might not be all of having the family come back in.
So I can start and maybe others can chime in. So the vaccine efficacy is, when we measure vaccine efficacy, we're measuring its ability to prevent illness, someone from becoming sick, and someone from testing positive. What is not measured in the scientific studies is the ability for that vaccine to stop someone from transmitting the virus or its effect on an outbreak, or ability to prevent an outbreak in a congregate setting. So until we see more of that effect, we want to be safe. As you know, throughout this whole year, things change on a dime and can change rapidly as we learn more. So we do hope that vaccine uptake, we hope that many people will get it, especially in our long-term care communities, and that will mean that people can see their loved ones as soon as possible. But we need to see the effects of the vaccine before things change on a national level and a local level.
Yeah, I would just add to that too. You know, it's understandable. We're all very excited that the vaccine is here, and it's understandable that residents and their families are looking forward to that day when they can visit with each other again. But as Vivian said, you know, we need to see and we need to monitor what the impact is of the vaccination program on new cases of COVID, you know, in the community and in nursing homes. And, you know, I'm optimistic that we'll get that data fairly soon. And this will be monitored closely. And as soon as it's felt to be safe, the restrictions will be lifted.
Wonderful. Thank you. When can we expect Connecticut nursing homes to begin to receive the vaccine?
So you might have heard on the news today, Connecticut is one of few states that will start vaccinating long-term care residents on Friday. A select few will be piloting on Friday, and then a larger rollout will start on Monday of next week.
Wonderful. We're very excited about that. And you should expect that your nursing home is reaching out to you regarding consent. They are looking to reach out to the resident themselves. If the resident is not able to express consent, then they would be reaching out to a family member, responsible party, power of attorney, or conservator for that reason. But they'll start with the residents whenever possible. Okay, I've heard that you can have a severe allergic reaction or allergies, that if you have allergies, you should not take the vaccine. Is that true?
So I'll speak to that a little bit. So there were a couple of reports of patients who had anaphylactic or severe allergic reactions after the vaccine from England when it rolled out last week. So you know, the FDA has given guidance on how allergies would impact the ability for an individual to receive the vaccine. And at this point, those individuals who have had an allergy to a component of the vaccine, unfortunately, there are very few components in this vaccine, should not receive the vaccine. But for other individuals who have had allergies to other medications, to non-medication triggers like foods and you know, insect bites and things like that, those would not be contraindications to receiving this vaccine. There are some special some precautions that would need to be taken for an individual who has had an anaphylactic reaction to a previous vaccine other than the COVID-19 vaccine, which basically entails a longer period of observation after the vaccine. But other allergies to other medications, particularly like oral medications and foods and non-medication allergies would not be a contraindication to getting the COVID-19 vaccine.
Thank you. Any other input? Okay. Is the Moderna vaccine preferred for individuals 65 and older, given the 100% effectiveness compared to the Pfizer around 95%? So should they wait for a different vaccine?
So in terms of the vaccine efficacy, they seem to be quite comparable in terms of their ability to prevent infection. And even the side effect profile is remarkably similar. So, in our hospital, we'll be essentially using them interchangeably unless new data emerges that shows that there's a significant difference between the two. It should be noted that the vaccine dosage scheduling is a little bit different. The Pfizer vaccine is 2 doses 3 weeks apart, and the Moderna vaccine is 2 doses 4 weeks apart. But in terms of effectiveness, they both are in that 95% area. I think that that's what we're looking for. As time moves on and we continue the phase 3 clinical trials, we expand them to other populations. We may get new data that changes that, but at this point, it doesn't seem like there's a significant difference between the two vaccines in terms of their efficacy.
Yeah, I would agree with that. And whatever vaccine your facility gets or has access to, I would encourage you to get vaccinated at that time. I think at this point, because there's so little difference between the vaccines, I think the timeliness of when you get it is probably the most important part of this.
So Tom, I'm going to whittle down your question or actually expand it to other homes as well. At least 85% of the residents and staff in a nursing home have had COVID over the past 4 weeks. And I think that's several homes that have had large outbreaks. Would those residents and staff get the vaccine, or would they now end up having to wait? So I think you kind of answered that earlier, that we'd want to see those individuals on the other side of having COVID and in the recovery period, and then they would be able to have access just like any other nursing home, correct?
Yes. CVS and Walgreens are reaching out to the facilities now to schedule. Many clinics are already scheduled. So when that day comes, when they're in your facility and you are not within that infection period, go ahead and get vaccinated.
All right. Marianne is asking, my spouse is in a nursing home. He will be vaccinated next week. I'm grateful. I'm a senior and I have comorbidities. I visit frequently under compassionate care visits. When can I get vaccinated? I understand there's the priorities, but I'm also at higher risk. So when should she anticipate having access to that vaccine? Anybody want to take that?
So that will be later. I can't exactly tell you when. That changes week to week. Dr. Bannock, I don't know if you're keeping abreast of that, but on a week-to-week basis, the governor and his advisory groups will keep an eye on that and continue to roll out those messages.
Yeah, I think that's exactly it. And a lot of it depends on the supply of the vaccine relative to the demand. We have a priority schedule that prioritizes residents of long-term care facilities and healthcare workers first, and then in that subsequent group will be the individuals in the community with high-risk medical conditions like you described. And my hope is that it will be soon, and if we get a lot of supply of vaccine, we'll be able to vaccinate a very large percentage of that priority 1A group, and then move on to the next priorities groups soon. But I think the exact timeline, unfortunately, we just can't commit to at this point.
Thank you. Question for Dr. Cole. As a past medical director of a nursing home, what would you recommend regarding the safe reintroduction of selected family members to address this extraordinary long isolation?
So I think we touched on this a little bit. In my profession, in medical directors, in really all healthcare providers who've taken care of patients in nursing homes over the last 9 months, we've become very much aware of the fact that lack of access to family, lack of, communal dining, lack of, the usual recreational therapy has taken its toll on other aspects of the residents' health. So the sooner we can remove these kind of restrictions, communal dining, recreational therapy, visitors, the better. But as we also mentioned earlier, it's not going to be appropriate, in my opinion, to remove those restrictions as soon as the residents or as soon as the staff are vaccinated. I think we're going to have to see what happens with the COVID incidents in nursing homes and in the broader community. But I'm optimistic that within a fairly short period of time, we can really begin to pull back and stop those restrictions.
Wonderful. Thank you. April, your question related to the recommendation for a resident who tested positive 5 days ago. I think we answered that a little bit above. Normally I read every single question that you guys send in. Because of the number of questions today, I'm gonna try to bunch them together a little bit. So please do not get offended if I skip it or if I don't ask it exactly the way it's written. I'm trying to make sure we hit on every topic here. So for someone who tested positive 5 days ago, as they said, them to be out of the period of time of being actively having COVID and being infectious and being in the recovery before receiving that vaccine. So Deb asks, what side effects of the vaccine, specifically intestinal distress, asking for a friend, are there any gastrointestinal side effects?
I'd have to look to see more details, but if there are, they're quite infrequent. It wasn't more than it's the side effects that occur more than 5% are sort of the ones that I've mentioned. It would be relatively infrequent if gastrointestinal side effects were do occur.
Yeah, I would agree with that. And one of the things we've witnessed in long-term care with COVID infections were quite a few residents and quite a few people who had gastrointestinal complications from COVID. So, all the more reason if your concerns are related to, gastrointestinal related complaints, all the more reason to get the vaccine, because those are issues that can occur with a COVID infection.
Thank you. So Lynn's asking, she just logged in. No problem, Lynn. She's sorry if it's already been answered, but will staff still be required to wear masks and other PPE if the staff member has been vaccinated?
Thank you, Lynn. No, that hasn't been asked yet, though we do hear it quite a bit. For now, face masks will still be required on all staff, anyone who works in a long-term care facility, and most if not all healthcare facilities as well, until we see a real effect of the vaccination. And it's difficult to say what will happen with face masks, but for now that's going to remain in place.
Yeah, and I suspect that wearing face masks will be one of the last restrictions that's dropped, even for facilities, and even maybe on a broader basis. So I think for the foreseeable future, the recommendation is going to be in place for face masks. Yes.
And one of the questions that wasn't on there, but we have gotten it, was related to, if I've been vaccinated, can I no longer give COVID to someone else? Like, could I carry, even though I don't get it, is it possible for me to carry it and give it to someone else? And therefore I should continue to wear my mask. Is that true or not true?
So that's a really critical question that we still need to understand. As Dr. Long mentioned, the vaccine we know prevents against people getting sick from COVID, but whether it prevents spreading COVID is still an area that's under active study. I think there's optimism that it does based on some sort of early data and what we see with some other kinds of vaccines. But we're really waiting for that concrete, definitive answer that this vaccine does prevent spreading COVID, in addition to preventing recipients from getting sick from COVID. And in the weeks to months, we'll have that information available.
Thank you. Is it true that the viral load in the vaccine is low? Is it true that the viral load in the vaccine is low, that others exposed will not catch COVID?
So in terms of the composition of the vaccine, I think it's important to know that there is no virus in the vaccine. Other vaccines that we give, things like measles vaccine and the inhaled flu vaccine do have virus in them. But the COVID vaccine does not have virus. It doesn't have live virus. It doesn't have killed virus. There's no virus in there. It works through an entirely different way in terms of generating the immune response. So the bottom line is, from the vaccine, you can't get sick from COVID-19 infection, nor can you give others COVID-19 infection related to the vaccine.
So for those of you who took biology in college, so the vaccine has mRNA, right? So it doesn't have DNA. It has RNA, which codes proteins. It tells your cells to make proteins, and the proteins that it tells your cells to make are those antibodies that stick onto the spike proteins, those little spikes you see on the coronavirus. And so the RNA tells your cells to make these antibodies that stick onto the virus, and then that tells your immune system to kill the virus. So I hope that helps explain it.
That's actually incredibly helpful. That's the first time I've heard it explained that way with all these meetings we're in all the time, and that was actually very helpful. Thank you.
I hope I got that right, Dr. Vanek.
That was a very good description.
Okay.
Thank you. Lynn has a great question here. How we know when the immunity from the vaccine is worn off and that we should receive another vaccination?
Another critical question. So, and that's information that we are learning as we move along. COVID-19 itself has only been around now for about a year, and we're learning about how long the immune system is protective after getting an actual COVID infection. And fortunately, it does seem to be quite protective, at least in the months after an infection. And we're finding that reinfections are pretty rare. But the next step is to study how long the immunity from a vaccine lasts. Unfortunately, only time will tell. I think this is an area of ongoing study. The clinical trials that are underway, those individuals will continue to be followed moving forward to see how long lasting the immune response is from the vaccine.
Okay. Robin missed, I think it was Dr. Cole's comment, or maybe it was Dr. Vanek, about respiratory issues related to the vaccine, and if someone is immune compromised, any risk there? I believe you said if they're having respiratory issues, they should talk to their physician because that shouldn't be something they're experiencing from the vaccine.
That's right. So after the vaccine is given, we see some of those symptoms like the achiness, the fatigue, maybe even some low-grade fevers, but that's part of the immune system responding to the vaccine. But the other symptoms, like respiratory symptoms afterwards, shouldn't be linked back to the vaccine. And I think at that point, you need to be evaluated for other causes, always including the possibility of a COVID infection that might have occurred.
And if part of the question referred to, a resident who has a respiratory illness and maybe, shouldn't get the vaccine, I think if the respiratory illness is clearly linked to COVID, as we talked about before, that might mean that their vaccination needs to be postponed. But many residents have minor respiratory illnesses, and those would not rule out vaccination at this point.
And in fact, I would say those are probably good people to receive the vaccine, because we know that individuals with underlying respiratory conditions are at risk for developing more severe illness if they do get COVID. So that's even makes it even more important to vaccinate those individuals.
Right. Dr. Lund, I think this one is for you. It's a question about the quarantine period after compassionate care visits. So you cannot visit again after your first compassionate care visit until the quarantine period is over. I just want to be clear on what to expect if you have a loved one. So this is specifically for loved ones or friends and family members who are COVID positive, getting a compassionate care visit. If you have one visit, let's say someone, it's end of life and they're having a few visits before the person passes away, what should that expectation be as far as quarantining?
Yeah, so we talked a little bit about quarantining yourself after visiting somebody with COVID-19. A subsequent visit, I think that should be discussed with the individual facility. I don't know what the regulations are in terms of federal regulations or state regulations on limiting, subsequent visits for people who have already visited their loved one with COVID-19. I think that discussion should happen with the facility, and I'll bring that back to our regulators. That question hasn't come to me, so that's a good one. I would want you to be able to see your loved one for a compassionate care reason.
And that's something we'd want to have that discussion and know about as well. And that's something we would work with DPH on, and we want to make sure that we're giving consistent and good guidance to you all, but also to the facilities so that they're not getting different information and that everyone is on the same page. So Dr. Cole or Dr. Vanek?
Yeah, I would just add that, this is such an important issue. Any visit obviously is important, but visiting someone who's near the end of their life is such an important thing to be able to do for both the patient and for their family. So I would be surprised if there was some kind of restriction on the frequency of those visits in that specific situation. I think that would, I feel that the risk benefit would be very much in favor of allowing the visits to take place.
Thank you.
Yeah, I agree. When you're visiting somebody, you're not interacting with a lot of other people. From an infection control point of view, I will bring that up as something I would definitely want to allow and work with facilities to let that happen.
Thank you. My mom has Alzheimer's disease and is primarily by herself in her room. She is there. Is there a time period after they get the vaccine when she should be monitored more closely? So right after the time they need to be monitored?
So there is a 15-minute monitoring period for everyone after the vaccination. If you have a history of a severe allergic reaction to any injectable therapies, then that time gets extended to 30 minutes of observation after the vaccination. Perhaps Dr. Vanek knows more.
I think that's accurate in terms of what the medication approval through the FDA authorization required. Now, I don't know, is the question, maybe the question is asking if there needs to be extra attention to side effects from the vaccine in an individual with Alzheimer's, and that may be worthwhile. I don't think there's a specific recommendation for that, but I think it may be worthwhile to give a little extra attention to those individuals after receiving the vaccine to see if there's any signs that they may not be able, or any symptoms that they may not necessarily be able to communicate well.
Yeah, and I would just add that, one of the advantages of having someone in a nursing home receive the vaccine is there are staff there. They're seeing the residents quite often to administer medications. It's a little bit more of a concern maybe for some older adults who get the vaccine in a community setting and then go home. There's not necessarily always going to be somebody there to monitor them. But in a nursing home, we have the advantage of having staff seeing the residents on a frequent basis. So I think they can they can monitor as part of routine care.
Excellent, thank you. Will pool agency staff and other staff coming into the building receive the vaccine? Is there any plan for that at this point, whether or not outside agency staff coming in receive the vaccine?
If they are healthcare, they will be towards the front of the line. I don't know for sure, honestly, on that one. I don't know exactly where they are, but eventually, yes.
Okay. That might be
we can get back to
find out and get back to
Yeah.
them.
Yeah, I would think from a principal's perspective, anyone on the healthcare delivery side who's coming in and seeing residents in nursing homes, certainly on any kind of frequency, should be getting vaccinated early in the process.
Another question about allergies. Any serious allergies that should be noted before having the vaccine? Especially allergies with an anaphylactic reaction, or penicillin, anything like that. Maybe even a dye or contrast. Should they let I would hope the nursing home would know that as part of their medical record, but is there anything that they should highlight?
So, I think the key things are that the vaccine is contraindicated in anyone who had a previous allergy to the COVID vaccine or its components. For individuals that have had a severe reaction or an anaphylactic reaction to another vaccine or to an injectable medication, they can still receive the COVID vaccine, but need that extended period of observation afterwards for 30 minutes. So those are the key allergy precautions and contraindications for the COVID vaccine.
I may have missed this, but do I have to have a vaccine before I'm able to visit in the nursing home? Is it a requirement?
At this time, there's not much thought about putting requirements on the COVID vaccine. We think everyone should want it and should get it. But yeah, there's no talk about requirements at this time.
What is the time period that would, sorry, my dog is visiting us. As everyone on knows, the dog always sort of this time, he knows I'm almost done for the night. He's going to start his antics. So everyone else knows that these guys have not experienced Mr. Finn yet, who's sitting here nicely. What is the time period that would be? I think maybe the person got cut off, so I'm not sure what that is. So Beth has a question. To be fair, anyone who's following the data knows that the risk that is presented by the staff and the infection rate in nursing home staff is staggering. Many of us look at all of you as medical professionals to address this. And the fact is that further isolation of residents is causing risks that outreach the risk of COVID infection. Please talk about the staff infection. So yes, Beth, we do know that in many of the cases in nursing homes, there haven't been a lot of visits, right, from family members, other people, but the caregivers have to go in to give care, and that there have been outbreaks due to that. I don't know if Dr. Long, if you want to speak to that.
Yeah, so if you are following the data, you will see that the staff rates are higher and reflect what we're seeing in the community in terms of the rate of growth. And if you follow the data for the residents, you'll see that the curve for residents is a lot flatter, which is good, but we can do better, right? So we are doing pretty well, mostly in preventing the transmission between staff and residents. We can do better, and we're really trying to figure out how to protect our staff. But the truth is, they have more exposure to the community, and their rates somewhat reflect the community's curve. So in order to protect our most vulnerable, and this is something that I've said to many audiences, including state leadership and the legislature and municipal leaders. And in order to protect our most vulnerable, we need to be bringing down the community rates of COVID-19. In addition to all that we're doing in nursing homes, beefing up the infection control, keeping an eye on source control and hand hygiene, making sure that the staffing is as adequate as possible, making sure that the staff understand that they can be asymptomatic and transmit infection even when they're not feeling well, even when they're feeling well. So there's a lot that goes into what triggers an outbreak or even a single case. And we at DPH, the state through our state testing program, the individual homes and their staff are all working hard to protect all of the residents. And then vaccination is one of our newest tools in the toolbox.
Yeah, so I would just reiterate that, as I mentioned earlier, it is a double tragedy for nursing home residents that not only have they suffered most from COVID and COVID infections, but they've suffered most from the restrictions that have had to be put in place to try and protect them. And now that we have the vaccine, residents should definitely get vaccinated. And I'm hopeful that staff will see this as being important, not just for themselves, but also very important for those very vulnerable patients that they care for. So we're hoping that as many people who work and live in long-term care as possible take advantage of this remarkable vaccine that is so protective.
Thank you. All right, we're getting some thank yous from out of state. There's many people on here from out of state that have loved ones here in Connecticut in nursing homes. So they just want you to know that it's helpful to get information about what's happening here, and they appreciate you being on. What is the time period of reaction that is expected, and will DPH be collecting statistics on residents as vaccinations roll out?
Good question. So we will be continuing to gather information about, we know our vaccine team will know when the vaccinations occur and some basic statistics on vaccination. And then in the infectious diseases surveillance team, we will continue to collect infections and cases among staff and residents. We're working out ways that we can try to figure out the effects of vaccination, but those are very difficult and intricate studies that are done more at a national level. And so locally we'll collect some data, but I think we're going to be looking to our partners at CDC and other national partners to give us a bigger picture.
Someone's asking, yes, this will be recorded, and it is being recorded, and it will be posted on our site as well as our regular website if people want further to look at it again or review the questions. Is it legal that a nursing home mandate that residents receive the vaccine? So they need to get consent, and that with any medication, a resident can refuse to take something if they don't want to. We are encouraging it. We're encouraging that people are fully informed. That's why we're having this discussion tonight. We want to make sure that people have the facts. I also want to point people to the state COVID vaccine site. That's where you're going to be able to get the most accurate, up-to-date information about the vaccine, about what's happening here in Connecticut, and it's a trusted source. So I would ask that people really look to that. I don't know if anyone else wants to comment on the whole consent piece. I must have covered that one well. I have strong feelings about that. We want to make sure that individuals are protected. And I'll be honest with you, I've told you all before, I sit on a lot of state meetings, and there has not been one meeting where any official has said anything but the fact that residents' rights need to be protected. They want to make sure that residents come first and foremost. But again, they want to make sure that you have all the information too. All right, will you be notified of the company of our nursing home? Oh, what company the nursing home is using. I believe they're all using Pfizer. Is that correct?
In terms of the vaccine, yes. Right now, it's all Pfizer. In terms of which pharmacy, your nursing home should be able to tell you that.
Thank you. So Lori, your question is how to reach our office. You can always call our 1-866 number. So it's 1-866-388-1888. And I have challenges at this time of the evening sometimes saying it correctly. I think I got it right there, but in the thread, Dan will normally throw up all of our contact information as well. Are vaccines mandatory for staff? I don't believe vaccines are mandatory for anyone at this point. Again, it's something that we're really highly encouraging everyone to do. All right, we talked about if a resident wants to receive the vaccine at a later date, will it be available to them? And again, it'll be working within the time period. And then after that time period, when the pharmacies are no longer coming in, is that something that could or should be individually set up?
Yeah, I know CDC and the pharmacies are working on that. It'll likely be available at the retail pharmacy locations as well, in addition to some outpatient locations. And then the discussion on whether or not nursing homes and other long-term care facilities can administer it themselves. That will take some further discussion, and it depends on some of the requirements, storage and handling requirements of the vaccines.
Transparency question. Will we find out the percentage of residents and staff in our nursing home that accepted the vaccine?
I hope that will be available at some point. I know it will be very difficult to collect in real time and may take some months to collect complete data, given that it's going to be rolled out, in multiple doses and in multiple visits.
Yeah, the other thing I would add to this discussion that I think is germane to nursing homes is obviously both staff and residents have the right to say no. We're going to be encouraging everybody to get vaccinated. They're entitled for their individual health information, including whether they got a vaccine or not, to be private. So it's not really information that you would necessarily expect to receive, certainly on a person-by-person basis. And, I think it's important to respect that people do have different opinions about these kind of issues. We're going to be spending a lot of time educating staff and residents about the importance of getting this vaccine, but it ultimately is a person's individual choice as to whether they get it or not.
Thank you. Very important. Nancy, I'm sadly reading your message here. Unfortunately, this vaccine is too late for so many people. Our loved one just passed away from COVID, caught in the nursing home. Best wishes for everyone. So Nancy, sending our thoughts to you. We know how challenging this has been for so many people. That is one of the reasons that having this access, making sure that residents and staff have access first is so important to me, as well as the teams of people that we're working with, because we know that your loved ones have been the most impacted. So you are in all of our thoughts tonight. But thank you for still being on. And so many people join this and share their experience. I know that many family members have found each other through this chat. I know that you all chat offline and in other groups. And that's really the whole meaning behind this, is to get the support that you need and able to, the ability to get through this together. And no one knows what you're going through better than each other, not even myself or my team. So thank you for still being on this evening. I know we're getting to the end of our hour. I want to jump down in some of these comments and see if there's anything we haven't touched on. That's another question about positivity. If a person with a disability who does not have a chronic health issue, but is within the general definition of a senior, would they classify for receiving the vaccine sooner than waiting months with the general population receiving it? So what about someone who has a significant chronic condition receiving the vaccine or a disability that might put them at higher risk? Will they receive the vaccine sooner?
So I'll comment.
Think that is, yeah, you're closest to the national recommendations, so go ahead.
So yeah, this is something that is in flux. So at this point, we know that phase 1A consists of the long-term care facility residents and healthcare personnel. What's going to happen next, I think, is still yet to be determined. But I think we'll get some more information in the very near future. So the group that advises CDC on prioritization is going to be meeting again soon, I think in the next few days, and may give some more guidance as far as which groups will get the next priority, including which medical conditions will be under consideration as being high-risk medical conditions that would put them sort of ahead in terms of priority over the general public. And then the other group is going to be the essential workers that are going to be in that next phase. So, that information is still to be determined and finalized. I think a lot of that will happen through recommendations from CDC, but then the states may also need to further refine some of those definitions when it comes to distribution. But high-risk medical conditions will be part of that prioritization process because those individuals need to be vaccinated because of their risk of hospitalization and severe disease.
Thank you. Will residents continue to be tested after they're vaccinated just to see if there are any positive cases? How will that work with testing after this period of time? That's a great question.
Yeah, so testing recommendations are unchanged at this time relating to vaccination. Testing should happen if people have symptoms associated with COVID-19. Current testing recommendations for residents of long-term care remain if you have COVID-19 in the building, at least weekly testing until no new positives for 14 days for anybody who hasn't had COVID-19 in the past 3 months. So that does include if you've been vaccinated. Nationally, the data will be looked at very closely to determine if and when those testing recommendations might need to change. It's important to note that the vaccine does not influence your test result. The mRNA vaccine will not, doesn't give you false positives, for example. It may affect the antibody testing, which is not routinely done anyways at all. So, or in rare cases, the testing that's going on in the nursing homes or in the long-term care facilities, the vaccine won't affect for now.
Thank you. So we have a question about the compassionate care visits. So Debbie, your question about the compassionate care visits and needing to quarantine apartment after it if you're in an assisted living. The visits that we're talking about are specifically related to individuals who are positive for COVID-19. So if you're doing one of those visits, they would hopefully already be quarantined. But if it's a regular compassionate care visit, we wouldn't expect them to quarantine. Many articles are coming out that the vaccine is going to be ineffective because of the virus has mutated. Is that correct? Is there any accuracy to that?
So I'm not aware of publications that are really describing that. I think the important part is that going back to Vivian's description of how the vaccine works, it basically creates what we call an antigen that looks like the spike protein, and that spike protein seems to be pretty consistent across coronaviruses, and I think that's the most important part. But I think we'll still get more information, but at this point, I don't think there's literature to suggest that due to mutations, the vaccine is going to be ineffective. But that's again something that we always have to keep our eye on whenever we develop new treatments and new vaccines. This is something we can't put our head in the sand. We need to really keep looking at all these different questions moving forward.
Another question about the requiring. So if anyone is hearing that their nursing home is requiring them to receive the vaccine, please reach out to our office. We will speak directly to those nursing homes. Department of Public Health also works with us directly on that. So we don't want anyone to feel like they have to do that. We're We're getting a lot of thank yous, I know we're going to let these guys go because it's well past the end of the hour. While not directly vaccine related, timetable when. So I'll stay on and answer a couple of these after, because there's a few more on here related to general things. One is related to a cocktail. If anyone receives a medication cocktail, should they wait to receive the vaccine? If not, will it have an effect on the effectiveness of the vaccines? So for that, I would say that not knowing what the cocktail is, I would recommend that that person talk to their primary care doctor. I guess, is that the group?
Yeah, as was mentioned earlier, there's really nothing in terms of the medications that someone's receiving that's going to be a contraindication to them receiving this particular vaccine.
Okay. And last question. Any word when the home COVID test approved and when people should start using that? I don't know anything about that one, so.
That's a good question. There are some, there's one that was just recently authorized by FDA, a home COVID test, I think in the last couple of days. So there's a lot of enthusiasm about these tests. I think what some of the challenges are, the ones that have been approved so far are a little expensive. So they would prevent things like testing every single day, which is one approach that people are talking about. But I think there is going to be a role for these tests. I think we're still trying to really understand how to use them in the most effective way. But I'm optimistic that this is going to be also part of our toolkit in being able to battle COVID-19. And in the weeks and months ahead, we're going to learn a lot more about how these can be incorporated. I don't know if Dr. Leung or Dr. Call have any other thoughts on home testing.
Yeah, I think it's too early to tell what's going to happen with this in terms of, so yeah, it looks promising. It's the rollout, the logistics and the technical aspects of the test. Somebody, what is the training and ordering and prescription that needs to happen? I know there is one that's over the counter, supposedly. I think we'll know a lot more next week and then a lot more in a month.
Yeah, I would just say, obviously, it's very convenient, the idea of being able to be tested at home, but we've got to be as confident as we can be that the test, when it's done, is meaningful and done correctly. So, but I am aware that these things are being developed, and I know that, as David mentioned, one of them has just recently been approved.
Well, thank you. I am going to stay on for a bit and answer some more questions. I know that you all, we've kept you longer than our hour, which we really thank you for being here tonight. And I've said it before and I'll say it again. I'm extremely thankful that I am here in the state of Connecticut, that Commissioner Gifford, the governor's office, my commissioner, Commissioner Porter, support us in getting the information from our state partners and make it so accessible to get it directly to you all. So I want to thank you each for being here tonight and for all the work that you continue to do for the residents and the family members in our state. So feel free to stay on, but I totally understand that some of you may have to drop off.
So Mairead, I am going to drop off, but I just wanted you and the others listening to know that if there is a silver lining from COVID in nursing home and long-term care, it's the fact that this part of the healthcare system is now getting more attention than maybe it has for a long time. There's a lot of people working, including in the governor's office and in the state legislature and DPH, to work towards improving care in nursing homes going forward. So if there is any silver lining from this, I think it's the fact that nursing homes and assisted living, but particularly nursing homes, are getting a lot more attention. So I'm very optimistic and hopeful that that will translate into better care in the future.
Thank you very much, and thank you for being here. It was amazing to have you all join us tonight.
Thank you.
Be well. Okay, it doesn't mean I'm going, just because I said goodnight doesn't, the tail starts going. He thinks, he knows that word now, it gets him all excited. Just settle down a second. So I know there's some frustration out there related to compassionate care visits, or sorry, essential caregivers, and that Connecticut doesn't have them. This is something that we've discussed, we've talked about in our visitation group, and really related directly to that CMS guidance that specifically speaks to that. It is something that we are advocating for access, we're advocating for what that might look like. And I think now with the vaccine, with more information, within the next month or two, maybe we will be able to gain some of that access that we haven't necessarily had. I don't want to say something or speak to something that, again, isn't factual and I don't know is going to change. And if it's not going to change at the federal level, it's not something that the state can just decide to move forward. So I did want to at least respond to that. And I know it's frustrating and upsetting to both residents and family members. How much time should be allotted between the vaccine? I think that we talked about that. That's specific to the vaccine. Sometimes it's 3 weeks with the Pfizer and it's 4 weeks with the Moderna. My sister and her facility are scheduled to have the vaccine this Friday. Today she just became positive. Can she still get it? So Janice, as we said earlier, they're talking about having to wait until after the period of time where she's actively contagious and having effects from COVID. But then after that period of time, especially if they're set up to have the 3 visits, hopefully by that period of time, she would then be able to access that vaccine. Can you emphasize the importance of getting information on the vaccine from a trusted site? Yes, so again, our site, if you guys click on it, we are only going to link you to the state site, right? We want to drive people to the most accurate information. So please, please, please go to the state site and you know that you can trust that information then. Okay, I think the rest are all huge thank yous for you all. I so appreciate you all being here, like we said. I will be back, what day is next week? Yes, I think it's right before Christmas, but I will come back, and if we're able to have other people join us, we will. Please continue to email your questions. It really does help us understand what questions are out there. I do bring them to my meetings with other state partners so that they know what questions are out there and we can help get you the best information possible. I hope everyone has a great evening. Stay safe and stay warm. With the storm coming, everybody stay safe at home. Could you please provide a link to where the recording will be posted? It will be on our Facebook page as well as our state site page. I'm guessing Dan Beam. I don't do that, Dan. We can all thank Dan for that. All right, so it is definitely time to go. I have a visitor. All right, everybody, have a good night. Thank you.
Thank you.